ventricular systole. Thus, with stenosis of these valves, or in the presence of a short PR interval or tachycardia, the valve cusps are still wide open when the ventricle starts contracting, and the first heart sound is consequently loud. The soft mitral component will only be heard if the listener concentrates on the period immediately preceding the obvious and quite loud tricuspid component. The second heart sound also has two components, both of which would be audible in most normal subjects. The first component is caused by aortic valve closure, and the second by pulmonary valve closure. Aortic closure is louder than pulmonary closure, and it is usually only the aortic component of the second heart sound which is normally present over the whole precordial. The timing of aortic closure is for practical purposes unaffected by respiration. The increased stroke volume of the right ventricle after inspiration results in delay of pulmonary closure. Thus, the normal second sound is clearly split in inspiration, but apparently single in expiration. The pulmonary systolic murmur and aortic valve closure are right ventricular output is diverted through the associated ventricular septal defect, and pulmonary flow is considerably reduced. The third heart sound is a low-pitched sound which occurs during the phase of rapid ventricular filling and is probably caused by vibration of ventricular muscle. It may arise in either ventricle and varies from 0.09 to 0.21 seconds after aortic closure. A sound which is exactly similar in pitch, timing, and intensity may be present in diseased hearts, and it is then usually referred to as diastolic or rapid filling gallop sound. The interval between the soft second and third heart sounds is 0.10 seconds, and in order to hear them, the listener should concentrate specifically on this part of the cardiac cycle. The fourth heart sound, atrial or presystolic gallop sound, is probably also a ventricular filling sound produced by vibration of the myocardium, but it depends on atrial systole. This sound occurs when the atrium contracts excessively in diastolic ventricle, and is never heard in normal hearts unless it has decreased heart power. Left-sided atrial sounds are commonly heard in audible, so-called rhythm sounds. Tachycardia is often